Good. All right. Hi, everyone, and welcome. Today is September 22nd, 2022. It is Suicide Prevention Month. We are glad to be here with you. I'm Crystal Miller, Veteran Services Supervisor from Mecklenburg County Veteran Services. If you would like to get updates, please go to NCGWG and join the email list. Look for Uncle Sam. We want you to join the email list so you get updates from the Governor's Working Group. You can always go back and see our presentations at NCGWG as well under meetings, and they will be posted soon after we are completed. First up today, we have the pleasure of having Mr. Secretary Walter Gaskin. You've got to come up here.
Oh, I got to come up here. All right.
This is just to forward your slide. You don't have a slide.
I don't have a slide. See, I'm good, so you can keep that. All right. Thank you, everybody. What I like to do with my 2 minutes is to say thank you for all the work that you're doing to make things happen. The division into the working groups is into the committees. It is on track and on target. So thank you again for being here, and I look forward to our presentation. We have a great agenda today, and again, thank you very much.
And for updates from the Department of Military and Veterans Affairs, Mr. Terry Westbrook.
Thank you, Crystal. I appreciate it, everyone. Thank you, all of you that are signed in, especially that are watching this virtually, wherever that's happening at. We are happy to be able to connect with all you guys. We really encourage all of you, come to Raleigh, come to the Governor's Working Group. This is a place where we're trying to make sure that we're doing the business that veterans need us to do in the state of North Carolina. Oh, wait a minute. There we go. All right, so a few things that are going on now from the Veteran Affairs side. Number one, the North Carolina Association of County Veteran Service Officers is doing their annual fall conference. That is for those people that are involved in it, that's where they do their continuing education requirements. All right, this is bad. Get up there. This is where they do their continuing education requirements to maintain their annual accreditation with the VA. They're going to get 12 hours of continuing education credit for attending this conference. So, the DMVA establishes the criteria. They establish all of the accreditation requirements and all the CEU requirements. And we work closely with the County Veteran Service Organization to make sure that we're offering relevant, timely, comprehensive connection to all of the stuff the VA needs us to be knowledgeable of, so that when we advocate for our veterans, we're doing the best thing we can. American Heroes for North Carolina is a nonprofit organization that's based in Forsyth County. Mr. Jim Hoffman is the president of that organization. They're one of the organizations that's really stepping forward in the state of North Carolina to advocate for veteran services and to create some regional veteran services coverage that we didn't necessarily have in the past. They are hosting a networking event on October the 7th, that's on Friday, prior to the Wake Forest Army football game that's on Saturday, October the 8th. They're actually going to be at the Lawrence Joel Memorial Coliseum doing this networking event. They're going to have a bunch of veteran-committed organizations that are looking to hire some people. So they're doing, this is going to be kind of a hiring event. There's going to be a lot of in-person interviewing kind of opportunities. The North Carolina Department of Military and Veteran Affairs is going to be represented there. Some of our other partners are going to be there. And it's going to be a lot going on that day. So the next thing, Eastern Band of Cherokee. One of the VA's initiatives this year is to connect to the Indian tribes across the country and make sure that we're providing services for that group of people. In accordance with that, the Eastern Band of Cherokee has its annual Fall Festival. It is the week. It's also on October the 7th. Secretary Gaskin and I will be in Cherokee for that event. So we'll be working with the American Legion and some other organizations that are part of putting that festival on. So we'll be seeing that and participating in that. Veterans Day activities. you never get started soon enough. We have, I already know of about 20 activities just in Region 3. I haven't seen the Regions 1, 2, and 4 yet from the state, but there'll be 75 different Veterans Day activities going on. The department's going to split up. We're going to cover some of them. We're going to be at them in attendance. Anybody else, as we get the list, Dave, I'll make sure that we get the comprehensive list to you to publish. We'll make sure it's out everywhere so that folks can see what the different world's going on. There's a lot involved with it. And having said that, Operation Greenlight, I'll talk just a moment about that. Some of you have heard of it, but basically Operation Greenlight is an opportunity to demonstrate support for the veterans community in North Carolina by showing a green light on your front porch the week of Veterans Day. Long and short, that's all there is to it. So we're the North Carolina Association of County Commissioners is fully behind this event. They've put this out statewide to try to get not only individuals but businesses and state agencies. We're shopping it here at the department through all the cabinet agencies. The Capitol is going to be lit. The Governor's Mansion is going to be lit. A lot of the other buildings, we're working on that. The county commissioners are working on things like the PNC Arena and Carter Finley Stadium and different buildings downtown Raleigh. I'm sure Mecklenburg County has got getting on there. So Wake County's goal is to beat Mecklenburg to the punch. That's the big thing going on there. So we've got a good, healthy rivalry between the two centers of the universe for the state of North Carolina. So we're looking very forward to how that goes. I encourage everybody to go to Lowe's and buy a green light bulb and put in your front porch, or buy one and put in a lamp and put in the front window of your house, or whatever it is you want to do that shows this support for the veteran services that we provide in the state. And we're working on that and trying to really make it a big deal. North Carolina State Veteran Homes, as you know, we have 4. We're trying to open a 5th one in Kernersville. We're in a cycle now where we're doing a lot of significant renovation to facilities. Our Kernersville facility in Fayetteville are right now on the agenda. We're spending some time to put a new roof, redo the heating and air conditioning systems, sprinkler systems, various parts of the building. We want to make sure the buildings stay current, they stay efficient. We hit the governor's EO80 priorities for energy consumption and green and all that stuff. So we're doing a lot to move our buildings into that 21st century model. Our Kernersville building, when it opens, has already got a lot of those things in place. So we're spending some time. We'll do Black Mountain. We've done some renovation in Salisbury. So we're excited to be able to move forward on all of these projects to get these buildings going. Our State Veterans Home Trust Fund is fully funded to support all that. So we're letting all of our legislators know how much we're doing, where the funding's coming from, how we're not asking the state of North Carolina to fund any of this. This is something we're funding internally. Our trust fund is designed to do that, and we really, we're proud of the fact that we can do these renovations and not have to get appropriated dollars or anything like that to get them going. So as you talk to your representatives, tell them how much you appreciate the way the state helps us run that fund to maximize support for the state veterans programs. Our legislative priorities, we have been working diligently over the last few months to make sure we've put down what the department needs to do to increase our capacity to provide veteran services across the state. We have a lot of things that we're working on in there. We're developing that list and getting it ready to publish. We will be sharing it with all of our partners out there, all of the veteran service organizations and the various agencies across the state that we partner with on things. So as soon as we get that done, we will be putting that out, certainly prior to the start of the legislative session. So give everybody a good talking point to talk to their local representatives about what the DMVA is trying to do and how much support we would appreciate getting that done. Some of our subcommittees, as you know, we established these subcommittees on education and social enrichment and benefits, employment and health care and some things like that within the governor's working group. We'll be hearing from some of our committee chairmen today as they cover where they're at in that process. They've done a lot of, the committee chairmen are working on a lot of initiatives. They've developed some products already. They've developed some resource requirements to help them move their products forward. We're working on all kinds of things from education opportunities for veterans to homelessness opportunities and trying to increase our footprint as pertains to offering something for the homeless people that we need to do for that. And finally, as you see on the board, big shout out, two of our major veteran service organizations in the state, Veterans Bridge Home out of Charlotte and Asheville-Buncombe County Christian Ministry out of Asheville, North Carolina, were both awarded the Staff Sergeant Fox Suicide Prevention Grant. That's a $750,000 grant. Each one of them was awarded this year for their efforts and what they're working on as it pertains to suicide prevention in the veterans community. And both of those organizations have a tremendous impact on what that's doing statewide. So we're very pleased that they were able to get that grant, and we congratulate them for all the hard work it took to get there. So thank you very much, Blake. Finally, some of the takeaways. Number one, you guys probably all heard President Biden declared that the pandemic's over. He didn't declare that the reaction to the pandemic and our ability to do and be cautious and take appropriate precautions was over, just that the pandemic portion of this event was over. So we continue to set that standard of taking care of our veterans, taking care of all of ourselves, making sure they all understand the governor's priorities of the 3 W's, watch, wait, and do all that and stay vigilant. So we're continue to push those things that provide personal safety and give you the opportunity to continue to do like this, have meetings where we don't have to have a mask on. So that's a big deal, and we do it. And as you can see, especially in our state veteran homes, which is a susceptible population, they're doing a fantastic job of managing the situation for the veterans there and keeping them all safe and healthy. And then finally, as we've already said, the governor's working group subcommittees, this is something that I'm very committed to. I want everybody to be committed to it. I want to utilize these subcommittees to improve veteran services in North Carolina and find innovative things to do that is good for our veterans, and efficiencies in work and funding streams and whatever it is we need to do that will help us push our programs forward is what we're all about. And these governor's working group subcommittees are our vision of where we touch that at directly and where we make incredible impact on it. So with that, I'll let all you guys go. Thank you for your attentiveness. Once again, please come to the next one in person.
All right, Mr. Cruz is not here, but we have Tara Ricks-Edger, is that correct? And she is the Director of Communications for Vision 6. Thank you for being with us today. And you'll just forward right there. I know you said you had some updates.
All right. Okay. Nice to meet everyone again in person. Feels like we're meeting for the first time again. Just a couple updates with our leadership throughout the entire state of North Carolina. We are one vacancy, and that is at our Fayetteville, North Carolina Coastal Healthcare Center, healthcare system. And following the retirement of Dr. Morgan, who has given almost 35 years of service to our country, either be with VA or military service. If you happen to see him or run into him or send him an email, just thank him for his service, because it's pretty admirable of him. And he will be retiring. And Miss Nikki Fryer, who is our chief nurse at Durham, she will be the acting. She's actually there this week. She's shadowing Dr. Morgan, and her first official start date as fully taking over the healthcare system as the interim director is October 3rd. So just a quick invite to you all. If you haven't received it, I'm still working on updating all of our contact lists, so please don't be offended if you haven't received it. It's on me. I'm still working to clean it up. But the State of Vision 6 is our community stakeholder symposium. We want to get really back on track with working with our community partners and making sure that you all know where our leadership stands and where we're going and for the next upcoming year and where we've been in the last year. So this event is both in person and virtual. So scan the QR. You actually can scan it right there. If you guys want to take a picture, you can scan it. It actually comes up. Or if you have other questions, you can just send me an email, and I'd be happy to answer any questions. And if you know anybody that is an advocate for veterans and that would benefit from this, please forward this invite to them. So next, I really want to hit on what's called the Don't Wait, Reach Out. I know you've all seen this campaign. VA started this campaign last year. But this is our suicide prevention campaign where we partner with the Ad Council. The ads the last 2 years are just phenomenal. They're backed by data. We know who these ads need to go to, and they're just rich in content, and they're very relatable. But the other piece from those digital video ads are all of the social media content, all of the fact sheets, newsletter, templates that you can just pull right off there. So you don't have to recreate. We don't want you to recreate. We want you to have something just your go-to. So if you have newsletters, magazines, you want to put the little 988 number underneath your signature block. Yes, there's Suicide Prevention Month, but in the VA world, every month is Suicide Prevention Month for us. So that link there will take you to a plethora of resources that you can use on all of your outreach efforts. I just wanted to highlight our suicide prevention lead, Brian Sangute. I'm sure you all you know him. He wanted me to actually highlight what he considers the high risk. Do I need to touch it? It's okay, it's coming back. He considers this the very high risk group. So the numbers I'm speaking about right now are for this particular high risk category, not the overall numbers. So in North Carolina, the most at-risk veteran age is 18 to 34 and have a suicide rate twice that of the national suicide rate at 36.8 suicides per 100,000 for North Carolina. So if there's a targeted age group that we all should really hone in on, it's that 18 to 34 age group. Suicide is the 12th leading cause of death in North Carolina and the 10th leading cause of death in the United States. The suicide prevention, the new report just came out this week, so I'm sure Brian, he actually didn't send me I thought he sent me the number that updated for that particular age group, but he sent me for the entire state. So take a chance to read that and see where we actually need to do that focused targeting. And last but not least, I wanted to show you these amazing ads. Let me just, I don't hear the sound. It's all right, they're only 30 seconds, they're very quick.
Can't believe you're doing this alone.
I've done it before.
I remember. You threw your back out. How you holding up?
Hand me that board.
Nothing wrong with getting help.
I'm good.
I did it when Felicia left.
I'll figure it out.
I know you will, but you don't have to do it alone. That's all I'm saying.
If I promise to look into it, will you drop it and help me build this fence?
Now you need my help.
It can be a real pain sometimes, you know that?
Mm-hmm.
If you or a veteran you know needs support, don't wait. Reach out. Find resources at va.gov/reach.
So that's the first of two. I'll show you the next one.
You know you don't have to wear your PT gear anymore, right?
It's comfortable.
So how's civilian life treating you?
It's fine.
When I got out, I didn't want to admit that there was anything wrong because it felt like a failure. And then I realized, like, there's nothing to be ashamed of. So I started talking to someone. Maybe you are fine, but if you're not, it's okay.
Thank you.
If you or a veteran you know needs support, don't wait. Reach out. Find resources at va.gov/reach.
So I'm just an advocate, as a veteran myself, a combat veteran myself, I'm an advocate that all of us are communicators. And if we all just share it once on our social media, then someone else, and we encourage other people to share it, people will. People will share it. And if we all just do that, we never know who we're going to affect. These ads are really powerful, and they do speak to a lot of these targeted audiences that I just spoke about. And again, don't wait, reach out, and that's it. Thanks, everyone.
Thank you so very much. All right, Mr. Belos is not with us today, but we do have the honor to have Miss Leanne Skeens with us. It's been a while. We're so glad to see you, and she is the Assistant Director at the Winston-Salem VA Regional Office. Welcome. And just forward right there. Okay, thank you.
So thank you, everyone. Good afternoon. Yes, it's been a while. I think it's since pre-COVID since I was able to make it out here and see you guys. I know Mark's been here maybe once or twice since then, so we're happy to be back in person and get to see everybody. Mark is at a director's symposium this week. It's the first one they've been able to do in person. Am I doing something wrong, Crystal?
No, it's just the...
Oh. Thank you. With all the directors across the country and with our acting undersecretary, Josh Jacobs. So it's a good opportunity for them to get together, especially in light of what we have going on now, which is the PACT Act. So everything that we talk about right now is all centered around the PACT Act and how that's going to impact our workload, how we're going to address that best for veterans and communicate all of that information to the veterans in the best way. I do have a website up here, va.gov/pact, so that will take you to all the information that we have currently on it. The frequently asked questions, in general, what presumptives have been expanded by the new PACT Act and when they will be in effect. So what I would say to you all is please encourage your veterans to apply now. We're still in the process of getting everything ready. We're still hiring, and starting in January is when we expect to actually be processing claims, but we do want veterans to go ahead, don't wait. Please do go ahead and file now for those benefits. And if veterans who have been denied, particularly for the toxic exposure benefits, please file a supplemental claim so that can be reopened and relooked at. So again, excuse me, again, file now for PACT Act. We recently were able to do, this is our second in-person event back to what we are now calling the Veteran Benefits Live events, VA in My Town. This one was in Charlotte, and you'll see up here we had quite a big turnout, a lot of success from that, a lot of numbers, 760 veterans from 11 different states at this event, which it's great to be back in person for those. I know some other stations across the U.S. have been doing virtual claims clinics, and we have done a little bit of those, but we're really happy to get back to what we formerly called the VACs and are now calling the the Veterans Benefits Live events, to meet with veterans, collaborate with VHA, NCA, the health, you guys, the vet centers, to provide in-person services to veterans. Something else going on for us that was exciting news, Mr. Belos was just recently invited to DC to accept the Customer Experience Project of the Year Award for VBA. This is the second year in a row that our office has won that award. North Carolina, and largely, due to a lot of what we have done across the state and a lot of what we've done in conjunction with the governor's work group and with all of you as participants, has really helped us be in the forefront of outreach for VBA. So what's coming up next? As I mentioned, the PACT Act, we're hiring RVSRs and VSRs, but we're also targeting military spouses, particularly for the legal administrative specialist position, which in easier terms to understand is a call center job. These positions are now going to be remote, so you can work from your own home anywhere in the country as a call center agent. So we're having a hiring event October 5th. It's a virtual hiring event, and you'll see the information there and the website if you want to register for that. The other thing going on in VA that we're really excited to talk about for us is the new app, VA Health and Benefits. So it's been a long time coming, something that you can actually access on your phone to take a look at managing VA claims and appointments and then message with your VA healthcare providers. We have an initial release out right now, and again, the information to that, the website is at the bottom of the slide there. So please take a look at that. Then lastly, just for your takeaways, as I mentioned, the new VA app and hiring, we are really, if you know veterans, if you know recent graduates who are interested in coming to work for VA and serve in the benefits side of things, we're hiring VSRs and RVSRs, so GS 7 through 10 and also GS 9 through 12. So look on usajobs.gov, point them there. They can talk to someone in our HR office as well to get that information. So just encourage people to look for that if they're looking for jobs. It's a great opportunity to serve veterans. The VA Benefits Live events that I mentioned earlier, the next one we have coming up is November in Wilmington. In FY23, we are hoping to do quite a few more of these events across the state. We're looking to do one in the Outer Banks area this year, which we've never done before, as well as some locations that we have been to before and that we frequent, such as Wilmington, which is one of our biggest events. And lastly, I would just say that a reminder that the Winston-Salem Regional Office is open to the public. And an exciting thing for us in the regional office is we are working to have veteran parking for veterans who come downtown to the regional office to talk to our public contact representatives in person. We've been working hard to get a contract in place so that we can pay for parking. As you know, our office is located downtown. It's really difficult a lot of times to find parking, but there's a new parking garage that's right adjacent to the plaza, to our building. We're hoping to have that going in October. You'll see more information about that on our website, and all of that is in the works, and we're really excited to be able to offer that, to make it a lot easier for veterans to access us in person. So that's it for me. Thank you so much.
Thank you so much for being here. I'm going to just plug in on the PACT Act. If you have questions about the PACT Act, please be sure to look up your local VSO. Veteran Service Officer can help you look at your benefits and determine eligibility for free. So there's a lot of ads on TV. Come and see us first, and let us look to see what your benefits may be, maybe before you hire a lawyer. Nothing against the lawyers who are trying to help, but let's come and see us if you think that you might be eligible for some of those conditions. Up next, I have Miss Renee Rader, and I'm going to get it right this time, the Division of Mental Health, Developmental Disabilities, and Substance Abuse Services. Thank you.
Thank you so much. Hi, good afternoon, everyone. It's great to be here again. I forget which way to push the button. Yay. I just have a few updates today that I wanted to share with you all. The first update that I am most excited about is that our division has hired our Veteran Services Liaison, and I'm even more pleased to say that she's here with us today. I thought I saw her here. I guess she had to step out for a few minutes, but we have hired our new Veteran Services Liaison. Her name is Audrey Armistad. She is a 23-year Army veteran with most recent experience in social services and special education. So she is really uniquely suited to support these programs, and we are so excited to have her on board. I know that some of you have already had the opportunity to talk to her, and I'm sure you'll have additional opportunities in the future, but I would say she is delightful, first of all, and second of all, she's really bringing new energy to our division and helping to reinvigorate our veterans programs. A lot of that has fallen off in the past couple of months because we've had some vacancies in some of our key positions at our division, but she is really filling that gap. And the other thing that she is very excited about, and I'm very excited about, is she's looking to help expand our footprint at the Division of Mental Health, Developmental Disabilities, and Substance Abuse Services with our veteran serving organizations. We do have a number of programs that support people with mental illness, people who are experiencing homelessness who are veterans, people who have substance use disorders who are veterans, but we're looking at other places where we can expand those services. So one of the areas that we're specifically looking at right now is our traumatic brain injury program. To date, that program has not had much of an intersection with our veteran serving programs, but we're looking to expand specifically in that area. So if you haven't had a chance to meet her yet, please feel free to reach out. I'm sure she'd be excited to talk to you. Other division updates in terms of key positions. So I think that I've mentioned before that we have our director and deputy director positions are vacant right now. We are getting very close to filling both of those positions. We are in the process of doing our second round of interviews. We've narrowed the candidates down for both of those positions down to 5 individuals, and second round interviews will be happening over the next couple of weeks here. And we hope to have that team in place, I would say, by the end of October. So that's very exciting. In the meantime, Deputy Secretary for Medicaid, Dave Richard, is acting as the interim director for our division, and he is also supported by Deputy Secretary of Health, Mark Benton. The other exciting leadership announcement that I have for our division is that we have finally filled the position for Assistant Director of Stakeholder Engagement and Customer Service. That is the position that was formerly filled by Dr. Michelle Laws, who I know came to these meetings quite frequently. I never say that we're going to replace her because you can't replace Dr. Laws, but we do have a new AD who will be starting with us on October 3rd, and her name is Jennifer Mead, and she'll be here starting, she'll come to these meetings starting in October, so you'll get a chance to meet her. Wanted to just point out a few things. I'm not following the slides. Okay. So one of the things that we are very proud of is that we have recently awarded $1.65 million to Cape Fear Valley Hospital System on peer ED connections. So we have, that program will be embedding peers in emergency rooms to support people in crisis, help connect them to treatment and recovery services in the community, and hopefully help alleviate the burden on our emergency departments. And we also have, I always bring the current funding opportunities to this group. We have a current funding opportunity for a prescription drug and opioid overdose prevention grant that we have. It's $50,000 per year for up to 4 high-need communities, and that's all around education, distributing naloxone, reaching out into communities, providing education. And the reason I always bring these is because we have a real commitment to partnering with our veteran-serving organizations, and I just want to make sure that you all are aware of those opportunities and are applying. So I just want to say a few words about Medicaid Transformation. This is one of the biggest things that's going on within our department right now. For those of you who are familiar with the behavioral health system in North Carolina, we are transforming the LME MCO system into tailored plans. That is scheduled to happen on December 1st of this year. Folks who will be enrolled in those tailored plans got notification in August of which tailored plan they'll be assigned to. We did get some feedback that some of that communication was a little confusing, so we've updated the information on the Medicaid website to help people walk through that and figure that out. We also, click. Oh yeah, okay. Let's see. The other thing that we have done with Medicaid is that during COVID, we had implemented a number of policy flexibilities so that people could get mental health, substance use disorder, and developmental disability services in very different ways, including like telehealth options and other ways of receiving services. And as the public health emergency is unwinding, we're taking a look at all of those flexibilities and seeing which ones make sense to keep and which ones will go ahead and sunset when the public health emergency ends. That information, I will say, also has been very confusing. So we have developed a website that has all of that information laid out and has some FAQs in case you are interested in that. Always happy to hear the focus on suicide prevention. Obviously, the Department of Health and Human Services is very invested in suicide prevention. This is National Suicide Prevention Month. I did want to draw your attention to the Department of Health and Human Services Suicide Prevention Action Plan that was just published. I think it went live this week. I put the link in the PowerPoint so that you could all take a look. One of the things that I wanted to just highlight for you as part of that action plan is if you take some time to look through it, you'll see that veterans are identified as a priority population within that action plan. We will be, as part of that action plan, developing a comprehensive suicide prevention advisory council that will consist of a variety of stakeholders from different backgrounds, and veterans will be represented on that advisory council as well. In addition to National Suicide Prevention Month, we have September's National Recovery Month, and so we had an event today. I feel like every time I come to these meetings, I'm always telling you we had a presentation earlier today, but we did have a webinar on recovery where we had an opportunity for folks who are in recovery from substance use disorders to talk about their experiences, to talk about services that are available in the community, and just really promote the successes that people have experienced in recovery. Also, I wanted to draw your attention to the North Carolina State Health Improvement Plan. This is a companion to the North Carolina Healthy 2030 Action Plan that we have that outlines our goals and priorities for the next 10 years. I just want to let you know that's out there. I haven't had a chance to really dig into it yet myself, but I'm sure it's a very interesting read, and look forward to sharing with you some progress that we've made on some of those items at future meetings. Since I am with the Department of Health and Human Services, I just wanted to make sure that you're all aware that the newest COVID-19 boosters are now available in North Carolina. We are increasing availability regularly, so those are available if you want them. You can always go to our website, which is myspot.nc.gov, for information on where to get your boosters or your vaccine or testing or even treatment for COVID-19. So that's a great resource. The other thing is that the state did expand the eligibility for the monkeypox vaccination. Originally, those vaccines were very limited. And we have gotten additional supply in North Carolina and have been able to expand the eligibility requirements for that. And I forgot to move forward. The last couple of slides are just resources on some things that we have available, and I just wanted to make sure that they were in the PowerPoint. But I did want to say, if you have an interest in any of the topics we talked about today, or any of the webinars that our division puts out, any of the funding opportunities, anything that we're doing in the Department of Health and Human Services, you can join our email distribution list. We publish a couple of times a week email blast with lots of good information. And the way that you get on that list, you can just email me and I'll make sure that you get on that list. And I think that's all I have.
Thank you so much. And I am up next. Again, I'm Crystal Miller. I'm going to give an update on the Governor's Challenge, the Mayor's Challenge, and also our two Together with Veterans programs here in North Carolina. So just a little bit about the challenge. In 2018, actually, Mecklenburg County took on the Mayor's Challenge to prevent suicide. Janine McGee, a dear friend of mine who has since passed, really started working on that program with Nicole French and Veterans Bridge Home. They got started, then in November of 2019, they brought me on board And these programs are working with VA and SAMHSA, so the Substance Abuse Mental Health Services Administration, who provides technical assistance to us in developing a program so that we can educate and make people aware of the issue and what we can do to prevent that issue from happening. I'll just point out, no one plan does fit every community. So whoever is out there watching this, please share, because we need for communities to understand that they are the ones who can build these programs and make a difference. So if I've got town managers, county commissioners, county managers, healthcare professionals, service providers out there, please share this information, get into contact with us. We have a lot of plans for educating our state on what they can do to help prevent and reduce suicide. Our 3 priority areas are pretty much the same across all 3. We cannot prevent suicide from happening if we don't know who our veterans are. We have to identify our veterans. I've said a gazillion times, let's fly over North Carolina and let's put flyers. Let's just send flyers out everywhere and say, are you a veteran? Please call Crystal. We want to identify our veterans. We know that a lot of our veterans are not using VA healthcare and they're not getting benefits, but we need to connect with those individuals to make sure they're doing okay. We want to prove, once we identify them and in our program, we will assess for suicide risk. We will be helping to teach others how to do that, how to ask if anyone has served in the military, and then also how to assess for that suicide risk. Then we want to teach our communities how to connect those individuals with care. And then our last but certainly not least is our lethal means safety program. We are not just partnering across the nation. Doc French, myself, Paul Berry, and Flo Stein went to an innovations conference at the beginning of August. We got to meet with all of the other governors working, or the Governor's Challenge teams. We shared ideas, but North Carolina is also partnering. We in Mecklenburg County are partnering with the state and Department of Health and Human Services. But I really want to point out our Together with Veterans programs. They also started around the same time. Carteret County, also called the Coalition of the Crystal Coast, hence the lighthouse there. And Macon County in North Carolina has a Together with Veterans program up in the beautiful mountains, and they are really working hard on education, promoting awareness, and promoting that we're trying to reduce the stigma and talking about this situation. So you all can read those slides, and there is our sweet Janine and Dr. Nicole French in their presentation at our first National Suicide Prevention Conference we were able to attend from North Carolina. It was up in Tennessee, and they talked about being an excellent buddy, and I'm saying it wrong. It is the Excellent Companion program. And how do you be an excellent companion? You talk to people, you be there, you be the one to ask the question, you talk to the people that you love, and be an expert companion to those people. This is just a little slide provided to us by SAMHSA to show how the interaction works. We've got all of our CVEBs working on this. We are working together with the Violence Prevention Branch of Department of Health and Human Services. One of our highlights is, of course, like I said, identifying the service members, veterans, and their families by implementing the Ask the Question campaign. We're working across subcommittees on that campaign. Dave Roddenberry, Governor's Institute, and myself are going to develop some materials that's going to make that education easier for communities so that they can access what they need. We're going to provide training on how to use the Columbia Suicide Severity Rating Scale, promote that connectedness via our NC Works network. So we've got Veterans Bridge Home and ABCCM managing those networks for us. We can connect veterans to the resources that they need, and we want to help other people understand how to connect to those resources as well. And then increasing lethal means safety. So Gary, VA Medical Center is a huge advocate, is a huge advocate for lethal means safety. I bet he's given out several 100,000 gun locks in his. I'm thinking Greenville, that hospital system there, they are working on building